Hi everyone, my name is Sydney Smar. I'm the epidemiologist here at Huron County Public Health, and today I'm going to be going through the Communicable Diseases Reporting Training. If you are new to reporting, this is going to be a really good training for you. We're going to go through the Ohio law regarding reportable diseases, and we're also going to go through reporting timeframes. If you are a current reporter, this is going to be a good refresher for you, and we're also going to go through any of the recent updates to the reportable diseases list. This training is taking place in April 2018, so you want to make sure you look at the ABC's list of reportable diseases. If it's been updated after April 2018, then you want to try and find the newer reportable disease training. Before we get started here, if you could take a moment and take the pre-training survey, you can either type this link into a new window or you can see the links below this video. By taking the pre-training survey and post-training survey, you will receive a certificate of completion. If you do not receive a certificate of completion within about a week, go ahead and email the email that is found below this video as well, and just ask where the status is of the certificate. If you want to pause this video while you take that survey and then start it once you've completed it, that would be a good idea. This link below here, you can see huroncohealth.com/disease-reporting. You should be able to find all of the resources that I'm going to talk about in today's training on that web page. The majority of them will also be found below this video. So before we get started here, we're going to go through the outline of what today's presentation is going to be. So first we're going to go through the diseases that are reportable by Ohio law. So we're going to go through that. Next, we're going to go through reporting timeframes, and we're going to break down those reportable diseases a little bit more. Then we'll move into using reportable disease forms. So how do you use them? How are they supposed to be filled out? And how do you send them to me? And then lastly, we're going to go through information use in Huron County. So how do I use that information that you are sending us, and why is it important? All diseases are reportable by Ohio law, and if you want to look up the specific law, you're going to look in Ohio Administrative Code, Chapter 3701-3, and that is where you can find the laws regarding reportable diseases. This is the Know Your ABCs, a quick guide to reportable infectious diseases in Ohio. So this is the form I was telling you about that you want to make sure when its effective date is. So currently, the most up-to-date ABCs guide is from March 22nd, 2018. You can see on your right-hand side of the screen is the link to the Know Your ABCs form. You can type that into a new window. You can also see the links below as well for that form, or you can reference the Public Health Desk reference as well. Now you can see with this form it's broken up into 3 sections. It's going to be Class A, Class B, and Class C. Class A is the first diseases I'm going to go through, and these diseases are of major public health concern because of the severity of disease or the potential for epidemic spread. And that is why we're required to report these in a timely manner. And we'll get into reporting here in a couple slides. Any case in the Class A group is unexpected and is of major public health concern. Some of the diseases in this class group are going to be anthrax, botulism, plague, rabies in human form, yellow fever, smallpox, tularemia. So all of these can be found in Class A. And I definitely recommend you take a look at this guide because it can be very helpful in breaking down the diseases for you. Class B is the second class that you'll see, and this class is much bigger than the Class A group. There's also a lot of variety of types of diseases in this group as well. And these are still of public health concern and need a timely response because of their potential for epidemic spread. So again, it is still of public health concern. And Class Bs can range from chlamydia, gonorrhea, hepatitis C, B, or A. Then you also move into gastrointestinal diseases like E. coli, salmonella, crypto. So there's a wide variety of diseases in this class, but they still have a potential for epidemic spread. Then the last class you'll see here is Class C. And these are any unusual incidents or epidemic of other diseases. So any disease can become reportable if it reaches an outbreak level. And an outbreak is just an unusual incidence of a disease. Those type of outbreaks can range from community, foodborne outbreaks, healthcare associated, institutional, waterborne, or zoonotic. So a lot of diseases can fall into this if they reach an outbreak point. So for example, norovirus is not on the reportable diseases list. However, we have many foodborne outbreaks related to norovirus, and it does become reportable. Other diseases can be things such as scabies or Fifth's disease, anything like that in a school setting, a nursing home. If it is unusual incidents, it would then become reportable. So the next section we're moving into is the required reporting timeframes for each of those disease classes. So again, we're going to start with Class A diseases. You can see here that I zoomed into that box a little bit more for you. Just a reminder, Class A diseases are of major public health concern due to their severity of disease or the potential for the epidemic spread. So you can see all of the diseases there that fall into this class. For any Class A disease, you need to report the disease immediately upon recognition of a case, a suspect case, or a positive lab result. So as soon as you suspect that a patient may have this disease, or you're diagnosing them with this disease, or they have a positive lab result, you are required to report, and by telephone only. You cannot report these diseases in any other format. It must be by phone, and you must speak to an actual person. So do not leave a voicemail. You must physically talk to someone. So during office hours, the phone number you can reach is 419-668-1652, and the extension you're going to go to is 258. If you get the voicemail, it will prompt you on how to continue on the phone chain to try and reach somebody else. Do not leave a voicemail. After office hours phone number is 419-921-8302. And you want to call that number if it's any time after 4 o'clock during Monday through Friday. So that's your after hours phone. So anytime the health department is closed due to holiday or it's just after hours, that's the number you're going to call to reach the health department and report your Class A disease. And remember, the most important thing about this is you can only reach us by telephone, and you must talk to somebody for a Class A disease. The next class is Class B. Again, I zoomed in for you so you can see the list of diseases here. And Class B is still of public health concern, but it is a step down from Class A. So it does not have to be reported by telephone. So there's a couple different ways you can report a Class B, but you must report it by the end of the next business day after there's an existence of a case, you have a suspect case, or a positive lab result is known. So you must report within the next business day. The phone number you can report it to is 419-668-1652. 1652, extension 258. Or you can fax the form, which we'll go through in a little bit, to 419-668-0152. So you can fax these. You do not have to talk to a physical person. You just have to make sure that the form has been faxed. Now, most hospitals will have electronic reporting for their lab results, and it will go directly into the electronic system. So if you're a laboratory personnel, you may want to either call the health department or talk to your supervisor, and they should be able to tell you if the labs are being reported electronically or if you are faxing the lab results. And it depends on each lab. For the electronic reporting, if you do not have electronic reporting and you want electronic reporting, please give me a call at the phone number as well, the same extension 258, and I can try and get you electronic access, or we can talk about what it is and how it works. And then the last reminder for Class B is you cannot mail the reportable diseases. They will not get here within the next business day. And I also do not recommend emailing the results either because of HIPAA information. So please only fax or call in the Class Bs by the end of the next business day. If you call, you should receive a call back from me or the epi on duty to get the information from you. If you don't hear from us within a day or two, you will need to call back as well to ensure that someone has gotten that reportable. But the easiest way is electronic or by fax. There were some changes to the reportable diseases list as of March 2018. Changes all revolved in Class B. There were no changes in Class A or Class C. And diseases that were added is the carbapentamase producing carbapenem resistant Enterobacteriaceae or CPRE, and it's only for the following 3 species that we're going to be looking at. If you have questions on how to report this or what the new requirements are for this, it's mostly going to come from hospitals. Please give me a call and we can talk through the reporting and when you would report these diseases. But that is the new disease that has been added to the list. Then there were some changes to disease categories. So hepatitis C has been split into 2 sections. So there's now hepatitis C non-perinatal and hepatitis C perinatal. So there are those 2 separate diseases now. They have been split. The hepatitis C perinatal is going to be very similar to how hepatitis B is broken up as well. You have non-perinatal and perinatal. For the hepatitis C perinatal cases, it's mostly going to be pediatric patients who are born to hep C positive mothers. So if a mom is positive and they suspect baby is, you may start reporting those as a perinatal versus a non-perinatal case. And the last class is Class C, and you need to report outbreaks by the end of the next business day. Again, that's any unusual incidence of disease, and any disease can fall under that as well. So healthcare associated, nursing homes, schools, if you had a group who went to a birthday party or potlucks. So there's lots of different groups of people that can fall into an outbreak. If you notice any unusual incidence of diseases, you want to call the phone number below, 419-668-1652, and you're going to want to get extension 258. This is the preferred method for reporting an outbreak because it is so different from the filling out of the forms that we're going to go through for Class B. However, you can fax the incident report and then I will give you a call, but generally there's additional information that is needed for outbreaks, so phone is that preferred method, and you can use that after hours line as well from the Class A section if you're reporting an outbreak as well. But it is required to be reported by the end of the next business day. So the next section we're going to go into is using reportable diseases forms. So there's different forms, and I'm going to go through each one of them and explain what the questions mean and how to fill it out. So the first form and the most common form you're going to use is the Ohio Confidential Reportable Diseases form. And this is where you're going to put most of the Class B diseases. There are some separate forms that we'll go through for a few additional diseases in Class B, but for the majority, you're going to use this form. You can use this form for Class A as well, but you still have to call and report it by telephone, but you could send the information to me via a fax. However, you still need to call me in person so that I am aware of what's going on and that I'm getting that information and we can discuss the patient further. So this form is broken up into a couple different sections, which I'm going to go through and talk about how to fill out. You can find this form in the links below, or on the Public Health Desk reference, or on that additional website that was on the pre-survey slide. So the first section of this reportable diseases form, you want to put what disease you're reporting. And you can also then put a dash for the test name that you're testing. So if it's Hep C you're reporting, and then you can put dash Hep C antibody test or Hep C RNA test. The odors number you can leave blank unless you know it. Generally, you will not know that. The odors is the Ohio Disease Reporting System, and that's that electronic system where all of the diseases are housed. So generally, that's going to be left blank. Then you're going to put the patient's demographic information, so last name, first name, middle name or initial, their medical record if you have it. This is very useful when calling to get additional information if I have that medical record number. Their address and county that they live in, their city, state, and zip, letting me know if the patient has expired or not. So yes, no, or unknown. If they have expired, please also write in the date of death. Their home or work number or alternate number that they can be reached at. Their date of birth, age, sex, and then if they're female, if they are pregnant or not. If they are pregnant, also please put in the expected delivery date. Then you're going to put in their race and ethnicity. And then this here is usually left blank, but it's actually a really important box to be filled out. Was the patient contacted? So is the patient aware of this disease? Are they aware that they tested positive for something or that they are ill with something? That's very helpful for me when I'm calling the patient to know if they've been contacted or not. And also I will try to reach the doctor first to ensure that the doctor has notified them. However, sometimes I cannot get a hold of the physician. So this is a really helpful box. Then last is a sensitive occupation. This is important for any of the diseases that have laws that restrict them from working if they're positive with certain diseases. So it's important if you know this information to please check it and put the name and address of the facility if you know it. Again, you're going to fill this out as completely as possible with all of the information that you know. Next is the section for parent, guardian, or alternate contact information, especially important for minors or someone who has a guardian that is taking care of all their medical information, or if they can't talk or something like that, who would I need to contact, or if they have passed. Then the provider and their address and phone number is going to be really important for me when I'm trying to contact the physician to have that physician's name and phone number. And lastly is the healthcare facility. So if they were at a hospital, what hospital, phone number and address, and then who's submitting it. So you want to always put your name and your facility and your phone number for who's submitting the form so that I can contact you if there's additional information I need, or if I'm just trying to figure out who was sending it to contact you. So this is kind of the contact section. Next is the information about the patient. So we're going to say, are they laboratory confirmed or clinically diagnosed? We want to put the lab's name, address, and phone number. When the result came back positive, it's going to be up here in the right-hand corner at the top. Then you're going to go down below laboratory address is date of specimens collection. So what day was it collected? Why were we testing? So is it a diagnosis, it's a prenatal, or there are repeat positive? And what specific type of test was this? So was it a culture, a smear, PCR? And you want to, next one is the type of site it came from. So was it blood? Was it a stool specimen, a urine? So you're just going to check whichever box of type it was. And then treatment. So if they were treated, check that box. If they're not treated and you've tried to contact them or you will treat, you want to check those boxes, unable to contact or refuse treatment, so that I can put that into the system as well. If they were prescribed treatment, please put in the box below when it was started and details. So what type of drug was it? What was the dosage? How often? How long? If you want to put all of that there. Then if you want to go back to the top left-hand corner of the slide here, date of report. So what day are you filling this out? Date of onset. So did the client have symptoms? If they did, when did they start? Date of diagnosis. So when did the physician diagnose them? If they were hospitalized, when were they admitted and discharged? And again, if the patient has passed, put their date of death here as well. And then at the bottom here is remarks, so you can put any other additional notes in here. I also like to have drug allergies because I do need that for every patient, and reason for testing. So the reason for testing up above just has some check boxes, but you can put reason for testing below, mostly for chlamydia cases. That's going to be a screening. So was it a prenatal screening or a yearly screening? Were they having symptoms? Were they referred from a partner? So you're just going to put why we were testing them. They came in with symptoms, or their partner told them that they tested positive, so they're getting tested. So you can put that there as well. And then any additional comments that you have for me that you want me to know. Then in this bottom box here is my contact information. So I have the fax number for the reports. Then I have the contact info, so that's our mailing address if you need to know where we're located. Again, please do not mail these. They will not get here in time. Then my phone number, so you can call me if you have any questions on filling it out, or the fax isn't going through, whatever. And then the other one is my email as well if you need to contact me. But again, please do not email or mail these forms, only fax, or you can give me a call and I can enter it manually. Next, I want to talk about why reporting negative results can be just as important as reporting a positive result. If you have a positive result for a patient and you have additional tests that are done for the same disease but are negative, it can be just as important to send those to us as the positive. It can tell us the full story and picture of the disease and what is going on. So for Hep B, for example, that can tell us if they're an acute case, if they're a chronic case, if they're infectious, if they maybe got it from the vaccine, so if it's just their antibodies and they don't actually have disease. So those negative results can really help tell the full story and help us with ensuring the public health's safety. So it is important that you send those as well if you have them and it's for the same disease. So specifically Hep B, A, and C, all of those can be important. There are several others on the Class B and A list that may pertain to as well. So just kind of be thinking about that when you're filling out the forms, that you may want to additionally add on the negative results to tell the full story. And then we're going to go through a few of the additional forms that are available. You will not use these as often, and they're going to be more specific to a certain disease. So the first form we're going to go through is the varicella or the chickenpox reportable form. And this form just goes into a little bit more detail for varicella specifically. So again, varicella is a class B. However, it's advantageous for you to use this form versus the Ohio confidential reporting form because it is more specific, and then I don't have to call you as often. So you're going to start with the demographic information of the child and the parent's name as well. What is their sex, race, and ethnicity? Then you're going to go into clinical information. So do they have a rash? When did it start? Where is it located? Do they have a fever? When was their first day absent from school? Because with chickenpox, you're not allowed to go to school for so many days after onset of a rash. So we'll want to know that as well. Did they receive their vaccination? If so, when was that? When did they receive them? Or did they not ever receive them? The severity, so how many lesions do they have on their body to see how severe the illness is? Were they hospitalized? What is the overall outcome if you know one? And then who were they diagnosed by? Were they diagnosed by a parent, school, or a physician? Schools generally will call me and say a parent called them in with chickenpox, but they hadn't gone to a physician. So then I'll recommend that they go see their doctor, and sometimes it ends up being chickenpox and sometimes it's poison ivy or some other rash. So I always encourage them to go to their physicians if they believe their child has chickenpox, and make sure that's what they actually have. Then you're going to put the day you're filling this out, who is filling it out, so what agency name, school, preschool, physician, lab. And then again at the bottom here is the fax number, 419-668-0152. And then if you have any questions, you can contact me at that phone number or email below. This next form is the Adult HIV Confidential Case Report form. So if you have a patient who has HIV, you're going to fill this form out as completely as possible. And then you're going to mail it, which is different from any of the other reportable diseases. You are going to mail this form, and you are going to mail it to the health department. And make sure on the outside you write confidential. And then if you want to give me a call and let me know that you've mailed that to me, then I don't even have to open the confidential letter, and I can forward it on to ODH. So just mail that. You don't want to email it. You don't want to fax it. You want to write confidential, and we're going to mail it. This then will get forwarded to the state, and from there it goes to the HIV coordinators. So there are coordinators for groups of counties, and they oversee all of the HIV cases within those counties, and they do the contact follow-up, the treatment. They do all of that investigative work, and they're specific to HIV and syphilis. So if you have an HIV adult case, please fill out this form as completely as possible and give me a call and mail it to us as well. So the next form is the Pediatric HIV Confidential Case Reporting Form. This form should be filled out completely, and then you want to mail it to the health department, same as the adult. Put confidential on the outside, and then give me a call here at the health department, and it'll be sent out to the HIV coordinators. So why is it important to report? It's important to report these diseases because it'll help control and prevent the diseases that are being reported. So by reporting them, we can do investigations, especially when you're talking, for example, salmonella case. Where did they get the salmonella from? So we do additional interviews that can help us figure that out and then potentially prevent others from becoming ill as well. We also give education to the patients about how to prevent spreading the disease to other people. And if they have not received treatment and the physician was unable to reach them, when I talk with them, I will also say, make sure you talk to your physician, call them back. It's important that you get treated. So all of that is why it's important to report and why there are laws about it. It also helps us determine disease distribution. So you can see the map over here for Ohio, and it's about Lyme disease from 2017. And so you can see the incidence per every 100,000 per year from 2007 to 2016. And then the green dots are all the cases from 2017. So it helps us see where certain diseases are a problem. Are there clusters, or is it widespread? So you can see where we have the most green dots, right down by Carroll and Jefferson County. There's quite a few of those there. And then when you get over to William, Defiance, and Paulding, those are pretty light counties. So it just helps us look at where diseases are and where should efforts be placed on certain diseases and different things like that. It also helps us prevent outbreaks. So if a client has salmonella, for example, and we talk about how to make sure we're washing our hands properly and letting them know that they may be contagious longer than they feel sick, and about proper handling of food. Or we have a food worker who has salmonella, they have to test negative to go back to work. So by having that disease reported, we're able to implement those measures and ensure that they're not getting other people sick by the food they're giving out at a restaurant. So all of that helps us prevent outbreaks and try and lower the disease in the county and state. So here's some of the tracking you can see that we do. This is the number of communicable disease cases in Huron County from 2008 to 2017 by category of disease. So we have enteric diseases, vaccine preventables, other communicable diseases, hepatitis, and sexually transmitted diseases. So we can watch the trends here. You can see hepatitis has been steadily going up each year. Sexually transmitted diseases bounces around but is slightly going up. Our vaccine preventables are going down or staying steady. So these all help us look at what are the trends of the diseases. So here you can see the number of vaccine preventable disease cases in Huron County from 2006 to 2017. And you can see that varicella or chickenpox has significantly decreased since 2006. So that helps us track the diseases and then see if what we're implementing is helping the diseases that we're trying to affect. So giving out the varicella vaccine, different things like that, we can see how the rates of disease have dropped, or the number of cases. On the other side here, we have number of hepatitis cases in Huron County. So we can also see how those have been climbing since 2008 all the way up to 2017. So we have been seeing an increase in those diseases over the last several years. It also helps us determine disease distribution. So it can help us compare ourselves to the state and national level. So for gonorrhea, you can see that we are under the rate per 100,000 persons comparing to Ohio and the national level, which is what we want to see. We want to be under the national and Ohio level. Then when you look at chlamydia, the same thing. We are below Ohio and national level. We are closer to the rate, but we are still under, which is again what we want to see. We want to be as low below that level as possible, but if we are above, that may be reason to look into it more of why we're higher than the state or national level for certain diseases. If you have any questions, please feel free to email the email found below the video. It's going to be scmar@huroncohealth.com. Or again, you can give me a call at that phone number where you report diseases as well, and you can ask for the epidemiologist at Huron County Public Health with any of the questions you may have on reporting. You can also put your questions in the comments of the post survey as well. So to take the post survey training, you're going to type this link into a new window, or you can see the links below. Again, fill this out to receive a certificate of completion for this training. So please complete the pre and post training. You should have completed the pre-training survey prior to watching the video. and now you should take the post-training survey after the video. Again, you can put some suggestions or comments in there as well, but if you'd like a timely response on a question or you have an important question, please give me a call or send me an email. Thank you for watching the video today, and I hope that this was a good overview for you on reporting diseases.